You've been told you're in need of an angiogram. Now, you probably have a lot of questions like, what is an angiogram? Why do I need one? How do I prepare? And what can I expect during and after the procedure? An angiogram is a diagnostic test where a doctor called an interventional cardiologist looks at the blood flow through the arteries that supply the heart. These arteries are called the coronary arteries. The coronary arteries can be thought of as the fuel lines that supply blood, the fuel, to the heart muscle. During an angiogram, the cardiologist injects contrast dye into these arteries while taking X-ray pictures to see how the blood flows through these arteries. This allows them to see if you have any narrowings or blockages. To do this test, a long narrow tube called a catheter is used to inject the contrast dye directly into your heart arteries. The catheter is inserted through a short tube placed in either the radial artery in the wrist or in the femoral artery in your upper leg. It is important to know that the decision about whether your wrist or leg is used is based on a number of factors, including the reason that you're having the procedure. In addition to looking at the heart arteries, the cardiologist may also look at the major pumping chamber of the heart, called the left ventricle. This shows the cardiologist how well the heart muscle is working. This is done by injecting contrast dye directly into the left ventricle. During this picture, it is common to feel warm all over, as your heart will circulate the contrast dye throughout your entire body. Patients are sent to have an angiogram for many different reasons. These may include chest pain or angina. Your doctor may have ordered an angiogram to determine if the chest pain you're experiencing is related to narrowings or blockages in the heart arteries. You may already have had other procedures leading up to this test, such as a stress test or a CT angiogram. The angiogram will for certain show whether you do have narrowings or blockages, as well as how significant they are. This will provide your doctor the most accurate information needed to best manage your care. Heart failure. This occurs when the heart is not pumping well enough to meet the demands of the body. There are many causes of heart failure, and an angiogram allows a cardiologist to determine if narrowings or blockages in the heart arteries have led to heart muscle damage, ultimately weakening the heart. Heart valve issues. Your doctor may suspect you have heart valve issues based on an echocardiogram, which is the ultrasound of your heart, or having heard a murmur when they listen to your heart. An angiogram provides more information to the healthcare team and helps determine if you need surgery to correct your heart valve issues. It also determines if you have narrowings or blockages in the heart arteries. If you do, the surgical team may plan to fix or bypass the blockages at the same time as your heart valve surgery. How do I prepare? If you're coming for your procedure from home, you will receive a phone call from the cath lab booking clerk, who will give you the date of your procedure. You may also receive a call from a nurse if you need specific instructions about your medications. As a reminder, the booking clerk will let you know if you require any tests prior to your angiogram. These may include blood work, an X-ray, or an ECG. Please ensure these are complete before your procedure date. You require a support person who will stay directly with you for 24 hours after the procedure. This person must be a responsible adult who is physically and emotionally able to manage a bleeding emergency. Your support person will drive you home from the procedure and will need to assist you with getting dressed and undressed for the first 24 hours. You will not be able to drive for 24 hours after your procedure, and this might be longer depending on additional procedures you might have. If you are from out of town, you must stay within 50 kilometers of Kelowna General Hospital for the first night after your procedure. Arrive for your procedure at the time requested. Bring all your medications in the original bottles. Bring your BC Health Services card. Wear loose-fitting, comfortable clothes. Shower or bathe the morning of your procedure. Do not eat or drink anything the morning of the procedure. You will have received instructions from a nurse if there are specific medications you should not take the morning of your procedure. Otherwise, it is okay to take your morning medications with small sips of water. You will likely have a waiting period before your procedure. Feel free to bring a book, your phone, or something to do while you wait. You should plan to be at the hospital for most of the day. Alternatively, If you're already waiting in the hospital for your procedure, the nurses looking after you will ensure you receive the proper medications and preparation for the procedure. Your nurse will let you know when it's your turn to come to the cath lab. You may bring a book or cell phone if you wish, but leave your other valuables behind, as you will be returning to your hospital room after the procedure is finished. Whether you are coming in from home or waiting in the hospital, once you arrive in the cath lab, your preparation will be the same. The nursing staff will collect a full history, including your medications and medical history. They will complete a full assessment. They will attach you to a heart monitoring system and check your vital signs. If you do not have an intravenous, the nurses will put one in for the procedure to allow them to give you fluid and medications. The nurses will check your right wrist and both upper legs to help the cardiologist decide which site is best for the procedure. The nurses will feel your pulses and will shave any hair from the forearm and upper legs to make sure the area can be cleaned properly prior to the procedure. The nursing staff work to get you ready when you arrive at the unit. However, there may be several patients waiting for their procedures. Everyone's angiogram is different and can vary in length from minutes to hours. This is unpredictable. Therefore, you may have to wait for some time before it's your turn. Before the procedure, you will meet the interventional cardiologist who will further explain the procedure, as well as the risks and benefits of an angiogram. The cardiologist will then make the decision about which site they will access, through your arm or through your leg. During your procedure, you will be moved from the admitting area into the procedure room. This has the specialized X-ray equipment. 3 or more nurses, a radiation or X-ray technologist will be present to help the cardiologist with the procedure. The cath lab staff will help you onto the narrow table where the procedure will be done. The staff will attach you to the heart monitor and to intravenous fluids. Your access site will be cleaned using a special cleaning solution before you are covered with a large sterile drape. This ensures no germs get into your puncture site. Once the cath lab staff have prepared you for the procedure, the cardiologist will come into the room. The entire staff team will briefly discuss your medical history so that everyone understands why you are having an angiogram. The cardiologist will then freeze the area around your access site before inserting the tube used to perform the procedure. It is normal to feel extra heartbeats and to feel hot and flushed when the cardiologist takes pictures of the pumping chamber of the heart. The cardiologist will tell you when to expect these sensations. During the procedure, it is important that you lie flat and still and to breathe as normally as possible. The cath lab staff will place lightweight equipment on your legs and chest. Moving around excessively can disrupt this equipment. It can also make the procedure more difficult for the cardiologist, as movement can affect the placement of catheters within the heart. You may feel the catheters as they move up to the heart, but this should not be painful. As soon as the cardiologist has all the images they need, they will explain the results to you. There are 4 possible outcomes. First, you do not have heart artery narrowings or blockages. The second, you have minor heart artery narrowings that would best be managed with medications. The third, you have heart artery narrowings or blockages that could be opened with stents or balloons. Lastly, you have heart artery narrowings or blockages that cannot easily be opened with stents or balloons, in which case you will be referred on to the cardiovascular surgery team to discuss your treatment options. If the cardiologist decides that balloons or stents are a good option for you, they will let you know when this procedure, called an angioplasty, should happen. If you are waiting for your procedure in hospital, it is likely the cardiologist will insert balloons or stents during your angiogram. However, if you have come in from home, the cardiologist may send you home to start you on medications required for an angioplasty, before having you return for the procedure. After the procedure, the cardiologist will leave the room and the nursing staff will begin your post-procedure care. If the procedure was done through the artery in your leg, the cardiologist may leave the tube or tubes in place to be removed in the recovery area. When you return to the admitting area, a nurse will remove the tube or tubes while holding firm pressure on your upper leg. This takes about 20 minutes and allows your body to form its own blood clot to start healing the hole. In some cases, the cardiologist may decide to insert a plug or stitch into the artery to close the hole. This will be decided based on medications you have received during the procedure, and it does not change the recovery course. Once the staff is confident you have no bleeding, you will lie flat on your back with your legs straight for approximately 2 hours. If you have trouble lying flat, let the nurses know, as we can help make you more comfortable during this time. After 2 hours, the nurses will teach you specific ways to get out of bed, sit in a chair, and walk to reduce your risk of bleeding. The nurses will continue to monitor you for bleeding until your support person comes to pick you up. When your support person arrives, the nurses will teach them how to help you if you have a bleeding emergency after you are discharged. If the procedure was done through the artery in your wrist, a nurse will remove the tube while placing a tight wristband that provides pressure to prevent you from bleeding. Once the wristband has been applied, you will be moved over to a stretcher and will return to the admitting area for your recovery. You will be able to sit up in bed immediately after your procedure. The nursing staff will slowly remove the air in the tight wristband over the next couple of hours. You are encouraged not to use your hand or wrist for 24 hours to allow the artery to heal and reduce the risk of scar formation in your wrist. Whether we've used your wrist or leg for the procedure, you will return to the recovery area where the nursing staff will closely monitor your vital signs and access sites for signs of bleeding. You will be required to stay in bed during this time. If you've come from home for your procedure, you will stay in the recovery area for at least 4 hours after your procedure while the nurses watch your recovery and make sure you're safe to go home. A light lunch will be provided once the staff determines it's safe for you to eat and drink. If you're an inpatient or have come from another hospital for the procedure, the staff will organize the return to your sending hospital or room as soon as possible. Like many medical procedures, an angiogram does come with several complication risks. You have been ordered this procedure as it is felt that the procedure's benefit outweighs the risk. However, it is important to understand the potential complications prior to giving informed consent. The most frequently experienced complication is bleeding or bruising of the groin or wrist. Although this can potentially be dangerous, the need for a blood transfusion is very rare. An allergic reaction to the contrast can also occur. It is important to notify the cath lab staff if you have a history of allergic reactions to contrast, commonly known as IV dye or iodine. Occasionally, contrast dye can interfere with kidney function, particularly in patients who already have impairment in kidney function. The cath lab staff are experienced with these complications and ready to act and treat you should these occur. More rare complications of an angiogram can include heart attack, stroke, or death. These complications are extremely rare, and your cardiologist can provide you with information for your own risk prior to your procedure. Now, this has been a lot of information. If you have concerns or questions, you can ask your doctor as well as review the written material supplied to you.